Welcome to Caring for Yourselves as You Care for Others. Sometimes as midwives, as students, as mothers, as family, we spend so much time caring for other people that we don't take care of ourselves. So I'm going to talk with you a little bit today about how to do that within your life. I'm Tonya Nicholson. I'm the Associate Dean of Midwifery and Women's Health at Frontier, and welcome to my home today. So today, this is my office, and this is my kitchen, and this is where I should be most days with the broom. So forgive me as I move about and talk to you about my life. So on this first slide, there's a reference to a link. If you go to the frontier.edu/midwifery week, you'll see a handout there that gives you a chance to rate your stress. So that just makes me feel stressed thinking about it, but I want to encourage you to do that if you've not already done it, and we'll reference it a little later. So now this picture looks a little bit like me sometimes when I'm in school or when I'm at work and I'm tired out and I've done too much and not taking care of myself. And I'm guessing that that's what you guys are doing too. Some of you were on call last night. You attended the birth of 2 or 3 babies. Maybe you saw clients all day in the office. You're exhausted, and yet here you are watching this today, just so you can learn a little bit more about how to take care of yourself and the importance of that. So here are some of the objectives. I'm not going to read them to you, but you can read them. Basically, the idea here is to think about how we balance or integrate work with our life and all the other things that we have to balance in our lives. We do crazy things. So this is just a little funny that sometimes we are requiring you to balance your work and your life, so you're having to attend something like this. So I hope you don't find this to be a requirement or a burden, but that you can take a little bit of a humorous look at the reasons and the ways that you can look after yourself. So just so you know that I know a little bit about this, I'm going to tell you a little bit about my life here. On your left is a poster of when I was practicing full-time at the Bond Clinic in Winter Haven, Florida. In the middle, I was juggling school and practice and family, and that's my little babies. And although there's probably, that looks like maybe some, I'm going to guess, French fries there, I was not cooking. That must have been from Burger King. And then I was a nurse, and I was a nurse midwifery student. All of these things are crazy in your life, so I do understand a little bit about trying to balance things. So I talked to you a little earlier about looking at that stress scale. So if you have filled it out, this just gives you an idea of where your stress level is. You know, even good things cause stress. When there are changes in our lives, like say you're changing to a new job or you're moving to a new home, those could be perceived as wonderful things, but they still cause stress in our lives. And so here are just some of the ratings and what that means as far as if you might have a stress-related illness. And I always like to refer to food. So stress is dessert spelled backwards. In my life, if you get a piece of news that you don't like, then get yourself a piece of cheesecake that you do like. So resilience, however, is kind of the opposite of stress, or it's the opposite of not being able to deal with stress. So we talk about how resilient a person is because we all face stress. But have you ever noticed that some people just seem to have one slam after another in their life, and yet they're able to keep moving? They're able to keep a positive attitude. They're able to keep functioning and being productive. And other people have less of a tolerance for it. So that is resilience. How much resilience do you have? And is there a way to increase your resilience? Well, yes, there is, and that's what we're going to talk about today. Here are some of the factors that are associated with resilience. People that care about you, obviously. Plans that make sense, and plans that you can actually be successful in. Viewing yourselves positively. Being able to communicate and problem solve when there is stress that could be reduced. Being able to manage your own emotions and feelings. And then the ability to care for yourself, which is the one that we're going to talk about. Here are some of the other ways that you can build resilience. So your connections, that's those people and those relationships. On through perspective, in other words, looking at things in a realistic way and not blowing them out of proportion. And I'm flipping through my notes here. I want to make sure you get all this information. making and or accepting and understanding that change is a reality. We're going to have change and it's okay. And to try to approach change with a positive attitude. Keep on moving. And that literally means physically and emotionally. Being able to keep physically moving in your life will reduce stress tremendously. And obviously it helps to reduce the incidence of many illnesses. Being able to make a decision. Some people are frozen when they are faced with decision making. They're frozen when they have lots of choices. It's difficult for them to decide what is most important and to make a decision and move forward. But sometimes the only decision you can make is to make a decision. I have to decide something and I have to move forward. Being able to understand yourself, feel good about yourself, keeping things in perspective, understanding what the important things are. And I'll tell you that in our lives, in our families' lives, it took a huge life-changing event to be able to capture number 8. Our baby Seth had a huge accident. He has a spinal cord injury. And I tell you what that did to us. It stopped us in our tracks and it made us reassess what is important so that we keep our focus on those things and not blow other things out of perspective. But family, work, faith, those things became front and center as the important things in our lives. Being able to maintain hope even in situations that appear to be hopeless and taking care of yourself. So we have to be very aware and cognizant to make sure that we take care of all of the parts of us. In other words, you have to look after your body, you have to look after your mind, your spirit, and your emotions. If you're not looking after all of those pieces, then you're not looking after yourself. So this is one real way that I make this work in my life. I work from my home quite a bit, so often I'm sitting at a desk all day long, click, clack, calling people on the phone, talking to them on the internet, and I realize that hours have passed and I have not moved at all. So one of the things I do, I like to call Coffee and Calisthenics. So I'm going to ask my friend Elliot, who's here in the room, to time me for 30 seconds and let me show you how I make my coffee in the mornings. So I actually use a Keurig, but we're going to pretend this is a Keurig. So I'm making my coffee. I've got it started. And once it's going, I try to do at least 20 squats. I need to get lower if I'm really going to work it. I'm doing my squats. Is that timer actually working? I don't think so. He didn't push go, so now I'm going to have to do more than that. I run in place. I do my stretches. There's somebody who's actually doing more work than I am. They're outside doing the cutting the grass. And I do that for 30 seconds to a minute. I make myself stop every hour or two and do something that matters for my body. So we're going to look at 2 views. Can you guys seem to not do that right there right now? So we're going to look at 2 views of ways to look at balancing life and work. Now the traditional view is that you separate them completely. You have separated work and life areas, and you try to keep them in balance. But to me, what I see here is that one is pulling against the other. The other view is a more integrated way of looking at life and work as a continuum. That works better. So this is that traditional work-life balance that we talked about, where work is completely separate from life, and you're fighting to achieve that balance. So here are some things that Usher says we can do to help improve our work-life balance. Building downtime into your schedule. In other words, schedule unscheduled time. Drop the things in your life that bring you down, whether they're people or activities. Now, obviously, if it's your work that brings you down, you might need to look at that. How can you improve your work situation so that it's not a downer? But looking at the things that stress you, that take your focus away from what's important, and trying to decrease those in your life. Now, I love number 3. Consider new ways for errands. What that means for me is online shopping sometimes. It might mean grocery delivery. It might mean asking my husband to pick up the dry cleaning instead of me doing it because he's passing by there today. So looking at new ways, not feeling like you have to do every one of your errands the way you've always done them. It might mean a trade-off. Like one of my friends loves to go to Walmart. I, however, love the grocery store because I love food. So she will often do my Walmart errands while I do the grocery store, and then we'll meet up and trade stuff. Keep moving. This is a resounding theme. You're going to see this on almost every slide over and over and over. The studies show us that when we look after our physical body, then our mental outlook and our physical outlook are improved. And taking some time to just take care of yourself and to not stress over things that might, on the surface, cause you stress. Then this is somebody else. Forbes says, here are 6 ways to improve your balance. Say no to perfect. Now, I love this one because you know what? I am not perfect. I will never be perfect. My children are not perfect. I cannot expect them to be perfect. And if I begin to accept that and not constantly strive for that, then possibly what that means is I will have more satisfaction and be more satisfied with the other people in my life if the expectation is realistic. Another thing is to unplug yourself. Schedule times in your life. If you're like me, in fact, my telephone is right there just in case it goes off. I cannot answer it right now because I'm talking to you. But God forbid that phone get more than 3 feet from me. We have got to find ways to unplug ourselves, even if it is for brief periods of time. For me, what that means, especially after Seth's accident, I became even more attached to my phone because I'm scared something's going to happen, is that there are times in our lives that I text all the kids in a group text and I say, I am turning my phone off. If there is an emergency, your daddy is with me. He has his phone on. What that means is he didn't check his phone like I do. So both of us become more unplugged, and yet we're still available for true emergencies. Take out of the things in your life that you can. Restructure your life so that it makes sense. And give yourself permission to start small. Don't expect that today you're going to become this person who runs 10 miles a day and who never eats a carb and all those other crazy things. Give yourself permission to start with just a little bit of something that's going to help you. Now, that previous couple of slides were talking about ways to completely try to separate your work and your life, but I will tell you that that is not really practical for me. Students and faculty and patients sometimes need me at all sorts of times of the day and night, so I cannot always completely separate the two. So I like this new integrated idea. That means assimilating your work and your life activities so that you can reach a point of satisfaction. And that's different for everybody. You might need that phone close to you, even if it means it's in somebody else's pocket for a few minutes. Or you might not need it that way. You might need some hours of separation, but finding ways to say, I can make this work together. Especially for those of us who work from home some, or who carry a beeper, and so you're on call, so you're not unplugged from work. There are many times that you're not unplugged from work. Finding ways, I like to say it's almost like cheating. Finding a way to make your personal life, things that bring you personal satisfaction, to bring them into your work life. So this is just another silly thing, because when we say work-life balance, what we really mean sometimes is we don't want you to have a life. We don't want you to have a life. We only want you to work. That's not what I want for you. There's really no such thing as work-life balance. Really, there's just life. And so balance is like a seesaw. It's elusive. It's difficult to maintain. And work-life balance is not meaning that there's an equal balance across your life and your work. That isn't usually reasonable. Or that you do an equal number of hours every day. That's not reasonable, especially for those of us who do call. You know, if you're on 24, 72 hours of call, it's all work. That's just the way it is. And you hope you can take a phone call from your kids, or maybe you can go home and have a meal. But all of that is your life, especially when your work can bring you so much satisfaction like ours does. The optimum work-life life balance will not remain the same. It will not remain constant. It will not remain still. It'll be different for you today than it is tomorrow. And that's all right. But some of the symptoms of truly having an unbalanced mix is those physical symptoms of stress like headache, upset stomach, sleep disturbances, changes in appetite. Those emotional stress related behaviors like depression, anxiety, irritability, difficulty in making decisions, having angry outbursts, or being resentful of the people that you love. And then personally, sometimes you find yourself pulling away from other people, pulling away from your family because you are stressed too much. You have to have that time away. So I want you to think of a moment when you felt like your life worked. What did it look like? Why did it look that way? Was it because it was truly a balance? Or was it because you still were able to focus on the things that you loved in your life? I'm going to guess that's what it is, because most of us never actually achieve that quantitative balance in life and work. But when we're able to get to a point of satisfaction where we can still focus on the important things and keep it in perspective, then we are at a place that's reasonable. So this is another way of looking at work-life integration. Looking at your whole life and realizing that you might not be able to maintain a work and a life calendar. So I maintain one single calendar that has everything on there. So if you looked at today or last week, you might see a meeting with the dean. You might see that I'm seeing patients and that I'm getting my hair done and that I'm eating dinner with my husband. You might see all of those things literally on my calendar, because you know what it does is it helps me as I'm going through my day to not only achieve the task, check the things I need to do and have to do, but it also helps me to look ahead and have an attitude of excitement about the other things that are coming during the day. Sometimes it means making time to be productive in your personal life. So it might be my day off, but I might answer email, because that means tomorrow when my work schedule is slammed, I don't have all that email sitting there. That works for me. It might not work for you. Find activities that cover more than one area. So for me, I have to stay physically active or I eat like a fool. That's just the bottom line. This makes no sense whatsoever, but if I get up and I take a good walk or a run or I do something active, then I seem to have more control over my life, especially not eating the rest of the day. But I also miss my friends. And so one of the things that I do is in the mornings, very often I'll have like what I call a real workout where I sweat and I can't talk and I'm just doing all those things. But in the afternoon, I take another walk, and it's my social walk. I walk with my friends and we reconnect and we talk about what's important in our lives. And so it's kind of like double dipping. I'm doing something good for me physically, but also good for me emotionally. And that's my friend Mary Beth. Sometimes I get a pedicure with friends so that I'm relaxing and having a social interaction. So we're going to have another interval here. All right, Elliot, give me 30 seconds. 30 seconds. Every hour, I set my timer at home so that I stop what I'm doing and I get up and I move. Now, some days it might be that I am sweeping the floor. I might have the music going. I'm sweeping and I'm dancing. Ugh. I actually don't sweep much. Usually I'm cleaning a toilet because I like the way pine saw smells. Or I might be cleaning the counter. I actually love to clean the counter. So I'm cleaning the counters. I've got my literally my timers going on at home so that I don't miss too much work time. Whoops, but it's amazing what you can get done in 30 seconds to a minute. I can clean a bathroom in under 3 minutes flat. I mean, really clean it, other than mopping. So if you put it yourself to the task, you'd be amazed what you can get done in a short time. So this is home and heart. Clean your toilet with gusto. Okay, now we're going to move on and talk more about having this integrated way of approaching our work-life balance. And one of the most important things is to look at your focus. Look at what's important to you so that you make sure that you maintain that within your life. If you find that you're doing all of these things for other people, which are wonderful in and of themselves, and yet you're doing nothing that regenerates you, you're going to never be satisfied in your life. So let's think for a minute first what the word regeneration means. Regenerate means to bring alive again. So what things make you feel alive? I tell you, for me, being with my boys makes me feel alive. So I have to weave that into my day. Sometimes it means a quick text. Sometimes it means now you're going to know I live in the country now. Sometimes it means going up through the pass and across the field. Yep, that's the country, to see one of the boys for 2 or 3 minutes. So I've taken a walk. I've seen the kids. I know they're alive, so I'm settled down a little bit. I've gotten a little bit of sugar from them. I come back home and I'm ready to work. Sometimes on the walk to see them, I talk with a student. I talk better if I can walk. So often I'm talking with a student, sometimes with a patient that has a problem that just wants to talk it through. So I try to make use of times in ways that I feel alive because of it. The things that physically and emotionally and mentally feed my soul so that I can live. And another thing is to think about your goals. I often think that we walk through our lives sometimes without purpose. We're so task-oriented. We're so busy making a living and getting the children to soccer on time that we forget why we're doing anything. So think about what is really important. Where am I going? And if I don't take a step toward getting there each day, then I'm not moving in the right direction. Which of my goals are must-have? Like, what kind of things do I have to have in my life? A productive career, for example, good relationships with my family. But what are some of the other goals or activities that are pluses? Like, I like to do them, but if they weren't in my life, I would be okay. Sometimes you have to sort some of those out. So, for example, being president of the PTA. I like doing stuff like that. I really do. But there are times and seasons in my life that it works and other seasons where it doesn't. Where if I'm so busy doing that, then I am not moving toward my real must-have goals. Okay, so I'm going to ask you to stop for just a second and think about some serious questions here. You define what's important about what you dedicate your time to. So what do you want? Why do you want it? When do you want it? And how are you going to get there? Now, I'm going to tell you a story about Logan. Logan is my oldest son. And there was a time when we moved back to Georgia from Florida. It was a time of a lot of changes in our lives. And he had a very serious girlfriend in Florida that he had stopped dating after we moved. The distance just didn't work. So I kept trying to suggest people he could date, as all mothers should do, right? So I suggested someone that I thought was a great match for him. And so he just kind of very seriously said, Mama, do you know her parents? Well, we live in a small town. So I'm like, yeah, I know her parents. And he said, well, I don't think they believe like we do. So I sat there a minute and I thought about whether or not to say this next thing. And I decided I should. And I said, well, Logan, baby, I'm not sure that you believe like I do. Well, he looked appalled. Oh, dear mother, what do you mean? Or something like that. And I said, you know, if you want to know what's really important to you, then you think about where you spend your time, your money, and your focus. Where you spend your time and your money and your focus doesn't look to me like the things that I think are important enough to spend my time and energy and focus on. So if you want to know what you really believe, what's really important to you, then check those 3 things. So what I'm going to encourage you to do is think about those goals, why they're important to you, what they are. Are you spending your time and your energy and focus to move you toward those goals? So what I did was I stopped and I asked Logan to do this, which he kind of half-heartedly did it, but I took it to heart for a minute. Because sometimes we lose direction and we feel like we're so busy trying to balance work and life that we're not really taking care of ourselves to move where we really want to be. So I decided to write a life mission statement. So if you think about a mission statement that businesses have, for example, they're short, they're to the point, they're meant to inspire you to be more and go further than you're currently doing. That's what a mission statement's about. So I stopped and said, like, what is really important to me? Who do I want to be? And am I doing the things to move there? So Your homework later is to write yourself a life mission statement. You might want to consider one for your practice too, so that as you make decisions, you can take that mission statement and say, is this activity or is this choice moving me toward who I want to be? So here was my mission statement. I envision a life filled with joy, recognized on a daily basis. I will celebrate each breath by working hard and loving harder. I will find moments of rest among hours of productivity and will acknowledge and grow from the pain that I experience. I will strive to inspire confidence, laughter, and respect in those around me. And so sometimes when I'm trying to decide what the next chess move is in my life, what I should be doing, I can circle back to this and it will help guide me. Sometimes it means to be able to live a life like this means that I have to be fit. It means that I have to have a career that's working. It means that I have to invest myself and my time in my family. That's what it means. That's the reality of how to get to these goals. So this is kind of what my life looks like. My life, up on the upper left, there's my Fitbit. I have it on at all times. I have it on right now. And just a little secret for those of you who are in a Fitbit challenge with me, I don't know what happened. I have not nearly walked this today, but for some reason it's registered about 30,000 steps. So I'm going to keep wearing it just like that because I like that. And on another note, our scale at the office this last week was weighing ridiculously low. So we had an afternoon full of fun as all the patients got on and off the scale 20 times, just an aside there. So I like to try to stay fit. There's my family and my husband, my office time on the right with clients, my extended family on the bottom, and I don't feel like I'm myself if I don't sing. So that's one of those self-care activities. I just have to do that. So speaking of singing, remember we talked about visiting all those rooms. We talked about feeding our soul, our body, our spirit, and our mind. One of the things that helps me to feed my spirit is to sing. So sometimes during the day, if I've had it with push-ups and jumping jacks and sit-ups, I'll just get up for a few minutes and sing something like, you can dance, you can jive, having the time of your life. Ooh, see that girl, watch that king, give it the dancing queen. Ooh. See, I just feel better. Don't you feel better? Sing happy birthday with me. I bet somebody in your family or your life has recently had a birthday. Who doesn't feel better by singing happy birthday? So you can do that at home right now. Get up and sing a song. Or if I need something a bit more serious, then I might sing, when I am down and oh my soul so weary. That's on the days that I'm doing more interpretive dance. Like literally, sometimes I turn on shows like Dancing with the Stars or So You Think You Can, dance, dance, dance. I turn it on and I dance just like them. I'll spend the morning on and off coming back to the TV for 30 seconds to a minute of dancing whatever they're dancing. And in that moment, I am a dancing queen. So let's get to the serious thing here. How can you take care of yourself when you're constantly doing harm to yourself at every turn? Now, I like this theory of harm reduction because I'm going to tell you the truth. I'm never going to be the person that doesn't eat a piece of cheesecake. I'm never going to be the person that runs a marathon every weekend. I have friends who actually are like that. For me, because overeating is one of my big issues that destroys the care for myself, I just have to reduce the harm. I'm never going to eliminate it. So what I do is I have to think about what can I actually increase or decrease or eliminate that's reasonable. So this theory of harm reduction first started out with drug users and HIV folks. In other words, what can these drug users, if we can't get them to actually stop using drugs, what can we do to reduce the harm that they're doing? So we introduced all kinds of programs for clean needles so that they weren't sharing needles. Condom use in sex workers. We might not be able to fix the whole issue, but maybe we can at least decrease their exposure to STDs and to HIV. So sometimes even under the best circumstances, you may not be eliminating the issue or completely correcting it. Perhaps you're not willing to care for yourself that much, but perhaps you can do some things. So one of the ways that I do harm reduction in my life is that I do get that piece of cheesecake, but I try to share it with somebody else at the table. And then I try to decide to take a walk with Mary Beth that night so I can walk a little of it off. I do a little bit of good to help decrease that little bit of bad that I'm doing. So decreasing harm sometimes is more reasonable. Most of us can't look at our lives and say, I'm going to lose 100 pounds. But even a 5% decrease in weight has a huge impact on a person's risk for diabetes and hypertension. So taking it in small bites and giving yourself permission to not be perfect and to start small, all those same concepts that we talked about earlier can be applied in this harm reduction. I want to tell you about a little video, and that's the link there. I would encourage you to take a look at it on YouTube. I think it's called 23.5 hours. If you want the best bang for your buck as far as physical health, wouldn't you do anything for this? If you could reduce pain and knee arthritis by 47%, reduce Alzheimer's progression in the elderly by 50%, reduce overall risk of diabetes by 58%, reduce the risk of fracture for a menopausal woman by 41%, reduce the risk of anxiety in women by 48%, the reduction of suffering of people that are depressed by 30%, lowering your overall risk of death by 23%. The #1 treatment for fatigue, guess what it is? First off, it's free. Secondly, it's easy. No special equipment. 30 minutes a day, 5 days a week of walking. Not even power walking. I like power walk sometimes, as my friends will tell you. But even just leisurely walking, like just that social walk with my friends, 30 minutes a day, 5 days a week, all of those health benefits, that is a return on investment. So even if you're not able to do some of these other things, or just even if you don't desire to do some of these other things that might physically help you, this is an easy self-care approach, along with my intervals. I love my little quick intervals every day so that I don't keep my behind in the chair all day long. Just so you know, I am not a runner, in case you haven't already figured that out. This is just for fun. I love to make fun of myself a little bit. There is some pleasure in levity, and being able to look at a situation and say, I'm never going to be a runner. And I'm certainly not going to ever run with scissors. I'm never going to be a runner. But you know what? I can be a walker. I can be healthier today than I was yesterday. I can be more relaxed today than I was yesterday because I'm looking after myself. You know, we are so used to working hard that just stopping and not working is really hard work. It is very hard for me. I'm a busy person, and I don't mean busy as in activities. I mean just inside. I'm busy. I like to stay active. I'm thinking about 4 things, and I'm doing 12 things at one time. So to really stop and take the time to be still is one of the hardest things in my life. And to decide that I am not a sum of all the things that have happened to me, but I am going to be who I choose to be. I'm going to be that person one day, fingers crossed, that I wrote that mission statement about, because every day I'm going to take those little interval breaks and take care of myself. I'm going to be okay with the fact that I'm not perfect. I'm going to integrate my work in my life, and I'm not going to expect them to be totally separate, and I'm going to be all right with that. So as a last interval, what I'm going to ask you to do is to stop. Elliot's going to time me again. And we're going to take 30 seconds to just concentrate on ourselves and our breathing, who we are, and who we want to be. Visualize what you want in your life, the things that make you feel alive again, the things that nurture and move you toward what you want and who you want to be in your life. And remember that no matter what, as long as you're moving forward, you're going in the right direction.